It is Dr. Rogers here once again. Now, in my practice, I've witnessed an increase in the number of unsafe abortions that are actually coming in. Number of young people are reporting with complications due to unsafe abortions. And today, I want to give you some key, quick highlights about abortion. First of all, by definition, abortion is the termination of pregnancy before viability. And that means that age before the baby can actually survive on its own outside the mother's uterus. As per Ugandan standards, viability stands at 26 weeks, but in some countries it can go as low as 20 weeks. Now, abortion can be both induced or spontaneous, whereby spontaneous is also sometimes called miscarriage. Okay, but also we have a medical classification of abortion. For example, threatened abortion. This is where there's actually vaginal bleeding and there's some cramping, whereby the pregnancy wants to come out but the cervix is still closed, and this can be managed and prevented or controlled. We have what we call inevitable abortion, whereby the process is certain and it might not be reversed. The expulsion of the products of conception or the fetus is actually ongoing. We have complete abortion, whereby everything has come out and the person's uterus is now empty. We have incomplete abortion, whereby some of the things have come out, but some few products are actually still retained in the uterus. And this is very dangerous because it's going to cause continuous bleeding and also expose this person to infections unless if these products that are retained are actually removed. We have what we call missed abortion, and this is when the baby dies from the uterus. So the baby is actually in there, but it is dead, especially if it is still within the first 26 weeks, like I said. We have septic abortion, whereby someone had a miscarriage or had an abortion, but then they got an infection that has affected their pelvic organs. Maybe it has even moved on to the bloodstream and they're having signs of a disseminated bacterial infection, or what we call a septicemia. Making a diagnosis of an abortion actually requires proper history taking, examination, and investigation. I've realized most people, actually especially young people, do get abortions or miscarriages when they didn't even know that they were pregnant. So when you go to a health facility or when you're with a qualified health worker, they'll take some history around your periods, when your last period was. They'll ask about some symptoms that point towards pregnancy, like body weakness, like vomiting, among others. They will also go ahead to ask about vaginal bleeding. Want to see if you're actually bleeding, but also if you have some bit of low abdominal pain, back pain, among other symptoms. This person will go ahead to do some bit of examination, general exam, where they will assess you to see how your general well-being is. They will look at your eyes, look at your tongue, among other things, take your blood pressure, but also do some examination on your abdomen. Look out for any bit of pain or tenderness when they press down on your abdomen, among other things. This person will also proceed to do a vaginal exam, and this will help us ascertain whether the uterus is open, the cervix is open, or you have any other complications that maybe are coming through. And that brings me to some of the differential diagnoses that are there when it comes to abortion. So when someone is having vaginal bleeding, it could be from an ectopic pregnancy. Ectopic pregnancy, this is when the pregnancy implants in other sites outside the normal endometrial cavity, for example, commonly in the tubes. So the pregnancy is not where it's supposed to be, but it has gone to the tubes. That is tuboectopic pregnancy. You could also be bleeding maybe because of other conditions like fibroids, they're actually causing the bleeding, or uterine polyps, among other things. You could be bleeding because of side effects from some bit of malignancies or tumors. That's why it is very critical to fully investigate. You do some imaging tests like a scan, among others. You could also be bleeding from complications of family planning, for example, if you've been on any bit of contraception, but you could also be bleeding because of what we call abnormal uterine bleeding or dysfunction uterine bleeding. And lastly, it could be because of sexual trauma. You could have had a rough sex, either rape or at home, or anything that has caused trauma within your pelvic area can actually cause the bleeding. Some of the investigations that can be done include doing a pregnancy test. This might be a quick urine test or a blood test to ascertain if you're actually pregnant. The doctor might also request for other tests like a complete blood count, which is going to assess your blood levels, especially if you have been bleeding. Doctor will also request for an abdominal or pelvic or transvaginal ultrasound scan to ascertain if you are pregnant and if you're actually miscarrying or having an abortion, to see if there's some retained products of conception which need to be expelled as soon as possible. Blood grouping and cross-matching, because you might need to have maybe blood transfusion, but also we might do other tests like malaria tests, like urinalysis, because most times abortions, especially the spontaneous ones, come in as a result of these common infections. The management is going to be either medical or surgical, depending on the type of the abortion you're having, depending on the volume of products of conception you're having, and also the gestation age. So the medical management is basically going to use abortion pills, what we call misoprostol or misoprostol and mifepristone, to actually manage you. But for the surgical ones, you're going to use manual evacuation to remove the products of conception manually. So the doctor will actually guide on what he or she feels is the most appropriate as per the results of your examination and investigation. It doesn't end there. There's what we call post-abortion care, and these are services that are provided to all those people who have been through an abortion, because we understand abortion leaves complications, leave alone the medical ones, but also the psychological complications. So this person needs to be linked to care, counseling, among others. But also we don't want to have another abortion anytime soon. So you're going to link up this person to actually access what we call post-abortion contraception. As I finalize, we also have what we call unsafe abortion, and this means the abortion has been carried out by a person who is not qualified, who lacks necessary skills to carry out this procedure, but also in an environment that does not meet the minimum medical standards for safety. So this puts the person's life at risk, and most of the time results into complications. We need to understand that a number of people are still dying due to unsafe abortions, and currently they contribute 6% to all the maternal deaths that are being registered in Uganda. So we shall have more details about unsafe abortion, especially on my YouTube. And if in case you wish to learn, please check out the link in my bio, and we shall be able to learn together. For now, bye bye.